Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Atropine. Atropine is a miscellaneous drug which is used in arrhythmias. Atropine is an anticholinergic drug. It is used as drug of choice in empirical treatment of bradycardia. So in any patient who comes with bradycardia, we first give atropine because atropine can block the parasympathetic effect on the heart and thus it causes tachycardia. Atropine is used in digitalis induced bradycardia, and atropine is also used in AV conduction defects also. So if you see the bradycardia, for any bradycardia, the drug of choice for bradycardia, is actually atropine. Whereas the definitive treatment, if you were asked what is the definitive treatment of bradycardia, it is pacing is the definitive treatment for bradycardia.
thank you and thank you for watching.